In tonight's Facing Race, he made headlines last year when he resigned in protest from the Odessa Brown Children's Clinic at Seattle Children's Hospital, citing racism.
In his first television interview since then, Dr. Ben Danielson helps us understand what racism looks like in American healthcare and at Seattle Children's in particular, where he says top leaders should be replaced. When people ask you, is there racism in healthcare, what do you say?
It's undeniable, irrefutable. The data is there, it's proven and shown. And it's surprising to me that we still have to ask that question.
Ask Dr. Ben Danielson about racism in healthcare, and he can tick off a litany of disturbing studies on race and medicine.
Let's say you're a Black woman who has reached the heights of education and therefore pretty comfortable socioeconomically. In this country, the chance of you dying in pregnancy and delivery and the chance of your baby dying in pregnancy and delivery is higher than for anyone else, including anyone else who hasn't finished high school. And so what that means is that the issues of racism go beyond the issues of socioeconomics and poverty. The treatment of headaches is different based on the color of your skin. The chance of a woman getting adequate treatment for breast cancer, lumpectomy, or radiation therapy goes down based on the color of your skin. The chance of getting adequate treatment for prostate cancer and getting diagnosed on time for that adequate treatment goes down for men. I just had a knee replacement surgery, and the data from 2018 shows that if you're Black, you're less likely to be offered a knee replacement when it's the right thing to do for you. I think that was the last badge.
Danielson says Seattle Children's Hospital did little to address racism during his 20 years as the medical director of the Odessa Brown Children's Clinic. Children's Hospital recently admitted that security at the hospital was called disproportionately on Black families. And Danielson says often there were no translators for patients who spoke languages other than English. Was there overt racism toward you?
Toward me, yeah. I think a last straw of many for me was around this time last year when the same person who had used the N-word in describing me had also suddenly been touted as a champion for diversity, I think was the term that was used. And the best way to make an important statement about something then was to leave in protest.
Dr. Ben Danielson at Odessa Brown Children's Clinic at Seattle Children's has resigned.
That choice to step away set off a wave of protest. Children's launched an investigation into allegations of racism at the hospital, finding, among other things, that the hospital, quote, did not adequately investigate or address a 2009 allegation that Dr. Jim Hendricks referred to Dr. Danielson using a racist epithet, and that there is an environment at the hospital that excludes and undervalues people of color. Children's has released only an excerpt of the report and has declined to release the full findings. Recently, 100 Seattle Children's employees walked off the job in protest. They want the full report released.
You know, I share in their outrage. I'm moved by that strong voice, and they're calling for that not about me. They're calling for that about the hospital, about a love for a hospital that they know can be better. And I think that's really, really powerful.
Do you feel like things are changing enough at Seattle Children's?
To be honest with you, I really don't believe that.
So you think that the current leadership needs to go?
It's an outrage that we still have the same leadership in place. If there were any other sort of performance measure other than racism, I know that a corporation like that would never retain the leadership.
Danielson has since joined the Department of Pediatrics at the University of Washington School of Medicine. He says a change in leadership at Children's would be just the beginning of change. You say that we need to have measurable outcomes when it comes to fixing racism in healthcare. I'm wondering what that looks like.
We do not have a dearth of solutions. We do not have an absence of answers. We do not have a lack of strategies or ideas. I'm just going to be bold and say we have a lack of will. So the measures that we could be making are pretty clear when it comes to how we're creating opportunities for young people of color to consider fields in healthcare, for example, how our recruitment processes are happening to medical schools, how are we hiring and retaining staff at places like hospitals broken down by racial background and other forms of disaggregation. These are all measurable things at the environment and staffing and diversity level.
You've been an advocate, you've been an example. So what keeps Ben going?
If you look into the eyes of young people and you see the promise that they hold, and in a way, what's mirrored back to you is the expectation that whatever you think is hard is not that hard. I also think that, I think we should be a bit outraged, but I think there's a sort of love that can come from outrage, a sort of creativity that can come from outrage, definitely a sense of being in this together.
Yeah, because we are talking about people's lives.
Talking about lives, yeah, and futures. And we're talking about dignity. And I will not ever stop caring about dignity. And I hope that all of us feel that way.
So Seattle Children's is not disputing what it calls Dr. Danielson's experience during his time there. In fact, many of his claims are confirmed in an independent report commissioned by the hospital. The summary that's been released contains 11 key findings and 88 subsequent recommendations. The hospital says it's not releasing additional information to protect the privacy of those who had the courage to tell their stories.
It's frustrating, having had a child who's been a patient at Children's, to not have access to the full report. What more can you tell us about this report?
Yeah, a lot of people are frustrated with that, Joyce. So let's talk about the report. It was an independent report done by a prestigious law firm led by former U.S. Attorney General Eric Holder. And it will be the basis of an action plan that Seattle Children's is going to roll out next Wednesday. So they said to look for that, and it will be comprehensive, extensive, and they hope it will begin to address the systemic racism that the report says exists.
Fascinating.